Order at 11:02. Stand for invocation. Father, thank you for the privilege of another day, this beautiful day you blessed us with. May we seek your wisdom to give us insight and discernment as we make these decisions today. Thank you for the privilege of serving on this public health subcommittee, because our findings in this committee are of real consequence to our citizens. Pray you bless our time together in Jesus' name. Amen.
Amen.
Shelley, roll call, please.
Mike Dobbins.
Here.
Keith Austin.
Here.
Charlie Bezzard. Sean Crittenden.
Here.
Joe Deere.
Here.
Hayden Duncan. Rex Jordan.
Here.
Daryl Legg.
Here.
Wes Snowfire. Dora Petskowski.
Here.
Mary Baker Shaw.
Ani.
Joe Smith. Denise Taylor.
Here.
Victoria Vesquez.
Thank you, Shelley. Okay. Ms. Lisa Pivick, please approach the stage. And Dr. Gann.
Good morning. Good to see you all. Happy Halloween. You have my report in your packet, and I have a few things in addition to the report that I'd like to highlight, and then I'd be happy to entertain questions about the report or anything else that you have, if that suits the committee. The public health staff submitted another successful competitive opportunity application for another cooperative agreement from CDC. Since the last time we met, we were awarded the Good Health and Wellness in Indian Country Cooperative Agreement. It's a 5-year funding opportunity to reduce rates of death and disability from commercial tobacco use, diabetes, heart disease, stroke, and reduce the prevalence of obesity and other chronic disease factors and conditions in American Indian and Alaska Natives. This is the proposed 5-year work plan has strategies and activities to reduce the prevalence of commercial tobacco use by increasing the number of people who are referred to the quit line, reducing the prevalence of high blood pressure and stroke with community education and awareness of the prevention of heart disease, and reducing the incidence of type 2 diabetes. And that intervention is increasing the number of citizens that have access to the diabetes prevention program. As you will remember, the diabetes prevention program is not located within public health, but they're one of our strong partners that we work with, and we have a partnership with the DPP program for our public health educators to provide healthy native classes throughout the 14 counties. And the diabetes prevention program at Cherokee Nation just received national recognition from CDC. And to gain national recognition, an organization must show that it can meet CDC standards and effectively deliver a proven diabetes prevention lifestyle change program. It's an outstanding milestone, and credit to the Diabetes Prevention Program. Today we have Tanya Wapskini here with us as one of our partners, and I'd like to recognize her. She's been with the program since its inception, and I'm not sure how many years that is, but I'm thinking it might be 12 or more. So I'd like to congratulate Tanya, Tara Ritter, and the rest of the diabetes program for this excellent work. This is a great milestone for us. And another piece in partnerships that I would like to mention today in my comments is, as we talk about public health, we talk about the fact that it extends beyond our program walls. And there's a lot of public health work going on in all kinds of programs. And two programs that we have recently started working more closely with are the environmental programs and the environmental health programs. The environmental programs are led by Wayne Isaacs, who is in the audience today. And Wayne has helped us start a work group on childhood environmental concerns and illnesses that we're going to be working with over the next few years. The environmental programs, if you don't know what they have, and I'm just going to highlight because I don't know as well, obviously, as Wayne, lead testing, air quality testing, home energy audits, and they investigate environmental hazards in the community. We also have environmental health here, which is located in community services organizationally, and Billy Hicks leads those programs. They do inspections and investigations related to food, water, mold, and wastewater, And they do food service worker training that leads to certification, and technical support to engineering and sanitation facilities construction by performing site evaluations, water sampling, and analysis. And we have pulled those two groups in with our community health assessments that we're going to be doing in every county. And we want to welcome them today, and they're here to answer any questions that might come up that you have on environmental concerns related to any of the community health assessments that we've been doing. Which brings me to the next piece, which all of you know that we finished the Lynn Institute project in Adair County. And back in the first part of October, Lynn Institute presented to council members from District 7 and 8, also Mary Baker Shaw, Chair of the Health Committee, and some members from administration, including Deputy Chief Warner and Chief of Staff Todd Inlow. And they presented their findings on Adair County. They have submitted their report, had to be resubmitted back to the IRB, and it was resubmitted on October 21st. The reason that it had to be resubmitted before it can be posted on our website and released is the purpose of the IRB is to protect human subjects. And there were a lot of the qualitative community surveys, there were comments that the IRB was concerned they could identify people with the comments that they made. They were too specific. So they pulled all of those comments out and summarized the qualitative piece a little bit better and resubmitted. When they resubmit, IRB policy.
Lisa, could
yes.
you say who IRB is?
The Institutional Review Board for Cherokee Nation. When the Institutional Review Board reviews something before they release it, it requires that they have 2 reviewers, and they usually take 4 to 6 weeks. He's promised me that within the next 2 weeks it will be up on the website. And when they resubmit it, they have to start all over at the beginning, because even though they made the corrections that need to be made, they have to make sure that everything else is still as it was at the first time. So it should be up very quickly and for public consumption for you to take a look at, which leads me to the next piece, which in the report we talk about the tribal health assessment. And what we did in Adair County was a piece of what we're doing for the overall tribal health assessment. Our hope is that we identify and find the resources to do what we did in Adair County and move to the rest of the counties and do each county like that. We do a tribal health assessment, one, because it's required for our accreditation, but we also do it to help guide what we do in communities. Tribal health assessment collects and maintains reliable, comparable, and valid data that provide information on conditions of public health importance on the health status of a population. We analyze that, and then we help make specific recommendations from that then leads to the next piece that we're going to be doing in Adair County, which is Community Health Improvement Plan. And that is more based on providing the information to the community and letting the community say, okay, we see what the data tells us. Now what are we going to do collectively as a community, and what improvement plans are we going to make? So our plan is that we will move into the rest of the counties as the year progresses when we find the resources to do that. So I wanted to update you on that. The other update that I have today is on the physical activity assessment. The physical activity assessment is going on. It's almost completed. It's been going on since around the 1st of October, and you may have been or seen some events in your community where it's been taking place. There were a few events that got canceled in October due to weather or other circumstances that they rescheduled for next week. And so I believe there are 3 more community events that we need to get to continue getting that. So we're pretty much on schedule for the analysis to be back in the December meeting from those surveys. If any of you have taken part or seen the survey, it's a little lengthy. Takes about 10 minutes to do. We have it electronically on an iPad, or we have it paper. And we found the resources to provide an incentive to people to do it. So when they do it, they get a long sleeve t-shirt, which is good because I'm afraid they might not have done it otherwise. But we've been getting a good response. I talked to Dr. Garrett yesterday and this morning, and most of the districts already have enough surveys for the analysis, but we're going to keep the existing events, the schedule that I sent you, the couple that got rescheduled, we're going to keep those events on. So those are my comments. I'm happy to entertain questions.
Mary?
Yes. First off, I want to thank you for sending me that information I needed the other day. I was really grateful for that. I have a question. In your report, you said, talking about the environment and that you had people who would be able to answer our questions here.
Yes.
Is that going to work with our other environmental program? Our environment, who am I saying? Yeah, Tom. Are they going to work with Tom?
Wayne works with, Wayne Isaac that's here, he works within Tom's.
Well, good, I'm glad to hear.
Yeah.
I want to ask one question. Should we be concerned about the amount of mercury in the fish around the Stillwell area?
That's exactly why I have them here today. Would one of you like to come up and answer that question? They're both coming, so I'll step out for a second.
Gentlemen, I'm very glad you're here and how timely. Can you share with council here something about the mercury that's being found in the fish and how high those levels are and how safe our people are eating those fish?
Well, the recent identification by the Oklahoma Department of Environmental Quality, they have different levels of concern. That's a pretty minimal level that they recently released. I think Mr. Hicks would agree with that. There's a little concern over the sample size that they extracted to get that information. A little bit of background. Our office, we had a mercury pilot project at Stillwell City Lake, ran from 2016 through 2018. We sampled some 192 different fish. I think there was 6 different species that we looked at. And during that time period, we never found any mercury levels that were over levels of concern. Our air program that we have, and our shelter is located at Delonaghy. We do deposition sampling there from the rain. Basically, we collect the rain and we have it tested for levels of mercury. And then that'll fluctuate, and that's just based on the air sheds in our area and the way that the mercury disperses during certain times of the year. Kind of like with ozone. And in the summer months, your ozone is going to be at the higher levels. Well, we've seen that with mercury too as well. It kind of fluctuates throughout the year, throughout the different weather patterns. But there again, we haven't really seen anything that would put those levels into a concern for the community. Mercury is a natural occurring element. And so you're going to have mercury in those background readings. It's just part of it. The concentration with coal that we use, that's a release of that mercury to the environment. But fortunately, as you may already be aware of, a lot of our coal fire plants are switching over to natural gas, so we're getting away from that. Billy, do you have anything you'd like to add as far as
I think you touched on the sample size. That was the first thing that struck me when we reviewed the data from the Department of Environmental Quality, was that there was only 15 fish sampled out of the lake out of 3 species. There were 5 largemouth bass, 5 channel catfish, and 5 black crappie. The only fish that exceeded the mercury level was the largest largemouth bass that was sampled. And so there was no mercury found in the catfish or the crappie, so there was no advisories placed on those. There was only an advisory placed on the largest largemouth bass out of the lake, over 17 inches, and it was only given to sensitive populations. So pregnant women and small children were advised to eat no more than 2 of those a month. So it's like Wayne said, it's the lowest level of public notification that they will give in an advisory for mercury.
How did you advise the public about this?
The Department of Environmental Quality has a public website where they list advisories for mercury, and it was placed on their website.
So the average Cherokee citizen who's really proud to catch those largemouth bass, especially a big one you might want to mount someday, they're not actually, unless they Google what you just said, they're not gonna know, are they?
Probably not, ma'am.
Boy, we are failing on this one. I would think that we would want to put it in the Cherokee Phoenix and anywhere where someone can read.
I think
know-
there was a publication in the Stillwell Daily News. I think that there was an article
Stillwell
that came
Daily
into
News,
that.
so if I
But
subscribe
it
to that, I
doesn't
would know.
reach to a lot of people, I understand that.
I want to encourage your organization. I think it's wonderful you're all doing this. But if I was a pregnant woman and I was, counting on my husband to catch me some bass for dinner tonight, I would want to know. And I might not be reading that paper, but I want to encourage you all to do everything possible to alert these people. We owe it to our citizens to try to have normal babies, and I want to encourage you to do that. And I applaud that you're doing it. I don't understand why bass and not catfish, but what the heck? They're both good eating. But I would encourage you all to do that.
Certainly.
Yeah, well, one reason is bass is considered a predatory fish. It feeds on other fish a little bit more than a catfish does. So the bioaccumulation gets a little higher in the predatory fish than it does in the non-predatory fish. So that's why with largemouth bass, that's why you see the level that you see of concern. We did look at some of the other primary public water sources in the state, lakes, to see what conditions that they had. And I know Lake Sardis and Broken Bow both have higher mercury levels. And then we looked at those communities and those counties as far as their life expectancy. And like McCurtain County, where I believe Broken Bow is, it's 89.3 years. So their life expectancy in those areas with higher mercury is higher than what they are in Adair County with lower amounts of mercury. So I think there's a lot of other factors that we have to look at when we start looking at those life expectancy rates and the conditions that affect those.
I thought I saw some reports too, where even Grand Lake had similar mercury levels as Stillwell Lake, so.
The lakes in northeast Oklahoma, the level of mercury in the fish is a function of the water quality. Mercury, in order to be absorbed by a biological organism, has to be in a methylated form, and that generally occurs in situations where you have higher levels of organic compounds. So lower water quality, like you have in southeast Oklahoma, contributes to the fact that biological organisms can uptake the mercury in the water and it accumulates in their flesh. And then if you consume those fish, you get it in your body. So even though, according to the DEQ, we may have higher levels of mercury in the water in northeast Oklahoma, the biological organisms aren't able to uptake it and get it into their system like they are in southeast Oklahoma. So those lakes in southeast Oklahoma, Wayne mentioned Broken Bow, Sardis, Hugo, Wister, a lot of the lakes down there in that part of the state have much higher mercury levels and much higher and stronger advisories on fish consumption.
Thank you, Billy. Wes?
I just had a question on whenever we got this notification about those fish, primarily the largemouth bass. Did we notify Oklahoma Wildlife and Fishery about this, or do they get notified about it?
Well, actually, that notification come from the Oklahoma Department of Environmental
okay.
Quality. Yeah, we didn't issue that,
Okay.
no.
So they get the notification. I just wonder if there's any sort of way they could post on the lakes near the ramps or somewhere that whenever they have an increase, that there's a concern, even if it's a minimal level. It kind of works and helps us out if they would go out there and place those on the lakes. Maybe something that we might reach out to them on. But I think really it's just a concern like what we talked about, the water quality. It affects water level in order to get that mercury in there to get into an organism. That's why I've continually tried to stress our hunting and fishing compact is that right there leads us to have a lot of authority over the water quality. So whenever there's an issue with our fish and game, we have an environmental concern. It's typically what always comes to, and we were just out of NCAI, and every environmental aspect is always brought forth by an Indian nation, and that would give us even that much more leverage as having that environmental aspect of it from our hunting and fishing side, because we get notification of it. We know it's a water concern, getting mercury in water. It affects the livelihood of a lot of people, of how they fish and hunt, and that gives us a lot of leverage there. But I appreciate you guys getting it to the attention and working with us on that.
Thank you.
Appreciate
Certainly.
it. Appreciate it.
Sean?
When was the study that you all did? What years were that?
The fish study that I mentioned, it was 2016 through 2018. It was a 3-year grant that we did.
All right. This might be far-fetched, but in your expertise, in the year's time, you're not concerned with something happening in that year's time, are you? You quit it in 2018. You're not concerned about any type of pollution upriver or anything that could have caused it, and your study might have missed that little time frame.
I'm not aware of any single event that would have, raised the mercury level in the lake suddenly that would have then, gone into the fish.
Yeah, I know that was far-fetched, but, we
Right.
do a study at a certain time. Minimal level, and you guys have talked about other areas having the same, if not more, right?
Mhm.
So, now, I want to understand this. Now, this was DEQ study, right?
Correct.
All right, and you guys are just trying to help, right? I mean,
Right.
You're not responsible for this Stillwell City Lake, is what I'm saying.
Correct.
Correct.
And anything the nation's doing is just trying to help our citizens and everyone there, right?
Certainly.
So, have you guys went to, and I say you guys, like I say, we appreciate what you do, and it's really not your responsibility, but I would, if Cherokee Nation can do this, I would like to, and you may have already, get a sample of Barren Fork Creek or some of the ponds in the area, some of the springs in the area, and is that kind of in the plan since this come up on the radar?
Well, prior to this event, for the last 17 years, 18 years, we've been collecting samples in tributaries, some of the area lakes, with our clean water program. That's an ongoing process.
And
So
everybody's-
we have a lot of data on those areas like that, and we'd be happy to share them to you. We
but
can
those things, they're
consolidate those into a report if you would like.
right. Yeah, I'd like to see that, but you guys doing the studies, there's nothing in those studies you've been doing in the fresh water that concern you?
Well, actually, some of our studies have pointed to some of our streams, actually, the water quality improving over the years.
Well, that's good to hear.
Yeah, it's very good to hear.
All right, so one specific question from a constituent. They posted on Adair County website there. So it's a legitimate study by the DEQ. Once you have a mercury issue, whether it, minimal or whatever it is there any way to fix that? Or her words were, resolve the water containing mercury issue.
I don't believe there is really. It's really a long-term solution trying to identify what the sources of mercury are that's in the water. Like Wayne says, mercury is a naturally occurring element. It's going to be in the environment all around us. So you have to identify if there is any sources of mercury that are getting into that watershed that we could control or eliminate, and then see if there's a subsequent reduction in the amount of mercury in the fish tissue.
You guys' ears are perked up
Oh,
from
absolutely.
this study, right?
Oh,
Absolutely.
certainly.
And I know
Yeah.
that your services have been, available and everything. Let me just ask you this out of pure ignorance. I was just listening to my dad growing up. There was a certain time of year he didn't want me going fishing in the creek. Called it dog days. Water was kind of
Stagnant.
stagnant, and I guess, like you said earlier, it would matter when they done their testing, like you said, the temperature, and is that something that would have mattered in this study when they did it?
I don't believe so. You know, the mercury in the fish tissue accumulates over the fish's lifespan. So when they pulled the fish out, you know, that was a result of the, you know, in the case of a 17-inch bass, I would have imagined that fish is probably 4 or 5 years old at the minimum, and it's accumulated that mercury in its tissue over that 4 or 5 years, and that's why those larger fish that have been in the water longer have a higher level of mercury in them than the smaller ones, or the, like Wayne said, the species that aren't as predatory as they are on other fish. Now, I'm not saying that couldn't be a possibility, that might have some impact on the mercury levels. You know, the amount of water in the lake, the concentration of the mercury goes up if the lake levels go
I was
down.
just trying to understand it when he was talking about kind of the ozone and everything, certain time of year that the levels may be higher. Just to follow up, kind of what Mary was saying, and we all realize that you guys aren't responsible for Stillwell Lake, but I know your ears are perked up since all this is going on, and kind of like these other studies that we're hearing about, you know, there's studies that Cherokee Nation's not doing, but we have to come back and say, all right, Cherokee citizens, here's the way that our professionals see this, and, you know, just keep us updated like that, and so we can update them if you would.
Yeah, certainly, sir. And may I add to that, too, that our data that we collect, both our water data and our air data, is loaded into databases that are accessed by the public. They go into some databases that we work with EPA on. So, and that data is usually uploaded in real time. So it's available out there for the public to go see at any time. And then we actually have a link on the Cherokee Nation website to our air data. So if you have any citizens that are concerned about that, it's under the, if you go to the government and the Secretary of Natural Resources, click on that, it'll bring up a window there, and then under environmental, it'll have clean air, clean water, and on the clean air, you can go there and it actually shows the data that we're collecting right there. So,
Let me finish up. I'll finish just a second. So, what's your plans concerning this study? Are you just keeping an eye on it?
As far as the study that's already been done
Right,
about the
right,
mercury in the fish
right.
tissue, we're going to continue to monitor that, see if the DEQ does any follow-up sampling, and what their advisory level is. If that changes, we'll certainly try to notify everyone.
Yeah, and I would just ask, send it to a Cherokee Nation publication. I see Todd back there. Just, and I know the data's there, and but just something a little bit easier to
oh,
get
certainly,
to.
yeah.
And, from my perspective, one of my primary concerns is that Stillwell City Lake is a drinking water source not only for the city of Stillwell, but for most of the surrounding rural water districts who buy their water from the city of Stillwell. There was a request, I believe, made to do some additional sampling on the water because of that, and so we are going to, stay in the loop with that, and offer to help out in any way we can with those, if we need to help collect samples or get those analyzed.
And if they drag their feet on that a little bit, we've got the equipment to go out there and do it ourselves, right?
Yes.
If the constituents and myself and my
Yes,
family
if we want
hey,
to do
Billy,
that, yeah, we can do
how's
that ourselves.
water doing? We'll just keep in touch with you. And that'd be pretty easy, wouldn't it, to go
Yes.
out there and do a sample ourselves? Thank you for being in on it and all you do.
I think we
Any other
both,
questions for Billy and Mr. Isaacs?
we both have the in-house capabilities to do some water testing in both our shops, and then anything we don't have the capability to do, we have purchase orders set up with labs we can take samples to get tested.
Thank you. Thank you. That hit pretty close to home there, Mr. Dodd.
Okay. Mary?
Mine are for Lisa.
Okay, yeah, we're going to bring Lisa and Dr.
Hey.
Kim back.
Thank
We'll
you.
step aside.
Thank you.
You bet.
I
Thank
had
you.
Wayne, one final,
Yes, sir.
maybe only speculate, but a generation ago, were there mercury levels in Stillwell Lake?
That I don't know,
I
to
don't
be
know if
honest
there's
with
been
you.
any sampling done other than,
I think it'd be safe to say there were some background levels there because it's a natural occurring element,
Yes.
but
I'm not sure this is a recent occurrence. I mean, it's probably, this mercury levels been there a while, possibly. You can only speculate.
More than
I
likely.
guess.
Yes, it just hasn't reached the point of concern
Yeah.
as it has now.
Great, thank you.
Uh-huh.
Okay,
I'm so glad they were here. I could have never answered that the way that they did.
Counselor Shaw, I think, wants to ask you a question.
Lisa, we always appreciate you because you're always prepared. Thank you. Listen, I want to ask a question. I noticed in the reports about the community gardens. How many community gardens do we have in our in jurisdiction?
I would have to dig through and add them up. Probably, if I had to. Well, we're getting ready. We just started the school grants too, and that's 42. I would probably say that we have probably around 15, maybe
Wonderful.
more.
Wonderful. I
That's
was
just a
noticing-
guesstimate. I can get the exact number and send it to you.
I was just curious, and I noticed, I think it was Redbird, where they talked about how
Yes.
many pounds of produce, but what caught my attention was the pounds of herbs.
Mm-hmm.
Was there a reason more herbs went out per pound than vegetables or watermelons or anything else? I mean,
I can't answer that particular question, but I can find an answer for you and get back to you.
And then I had one question. Do you have any idea how many opioids that are out in Cherokee jurisdiction that are illegal?
That's possibly a Dave question, Dr. Gain question, as he
I was just
runs
wondering
the
if you had any
opioid.
idea.
No, we have good data on the prescription opioids.
Right.
Of course, the Oklahoma Bureau of Narcotics and Dangerous Drug has partnered with us to feed us those data. I don't, I mean, one surrogate we use is our hepatitis C numbers, which we have a good handle on because that comes primarily, we think, from injection drug use. The marshals might have some better numbers
Yeah, that's what I
like
was
that,
thinking.
but it's difficult. Our MAT program, medical assisted treatment for opioid overdose, is for opioid addiction. It's really taken off. A lot of patients that are getting treated and recovering from opioid addiction. It's really, the patients love it, the doctors love it, and the nurses love it, and it's working really well. And it's only going to get bigger. Julie Skinner from Behavioral Health kind of runs that program. And you'll see some really good things come out of that.
I appreciate it. Thank you so much.
Victoria?
I have a question for Lisa.
Yes.
I noticed in the notes on page 8 of yours about the different activities, and this is under Craig, Nowata, Washington, Tulsa County. The very last sentence about attending the Craig County local emergency planning committee. Is that something that you attend every month, and who conducts or holds that meeting?
That is the educator from that area. It's Amy DeVore, and she does go every month. And my guess is that that's held by the county local emergency management. She networks with them.
Okay.
She's a staff that works as public health educator out of the Veneta facility.
Check with her if I want to be included.
Yes.
Thank you, sir.
Okay. Lisa, are there public health personnel at every one of our clinics?
Every one of the facilities, with the exception of Nowata, and that's being advertised, and candidates are being interviewed and taken right now. But yes, at this point, we do have public health educators at every facility except Nowata, and that's coming.
Okay, great. John?
Yes, thank you. Kane and I are having a community meeting. We talked a little bit about it, but are we going to be able to get some of those surveys, either paper-wise or the iPads? Can we get those?
Let me check with Dr. Garrett and see what that would do to the numbers that he's set up, and that he's worked with Dr. Spicer to get specific numbers for every district and how many surveys that we get. And I'll see if I can get that done, but we'll check.
Just for our area, I guess you and I could print up something, because we get lots of calls about when's this thing coming, and we're holding them off a little bit, say in December, right? And but we're looking for a pretty good crowd,
Okay.
and that would make the folks, feel like they're kind of involved. It's going to be a good crowd.
I can check and get back with you, if that's
Thank you,
okay?
thank you.
Yeah, thanks.
Go ahead, proceed, Lisa. You have some-
My report is complete. The only thing else I would like to say, I know in Wayne and Billy's comments, there was discussion about letting the public know. And I think one of the reasons that we're trying to partner all together, and, credit to Wayne and Billy, we're trying to break down those silos between departments and divisions and work together and put all that information in our community health assessments so that they're all of the information that we can get's located in one place. And I think that's something that'll be new to these community health assessments, is making that information available and then figuring out how we do more community outreach collectively through all of our programs working together. So.
Any other questions for Lisa? Dr. Gann, anything?
No, sir.
Okay. Our next meeting is December 16th. Lisa, do you think, how close will we be toward the final report on December 16th?
We should be. From the initiation of the project, I'd let Dr. Garrett know that these have to be ready, the analysis has to be ready in December. That's why trying to get that would be the holdback on doing surveys past next week, is that they couldn't be it'd be hard to include them in the analysis. But we'll see what we can do. We have full intention of having it ready for that meeting.
Okay.
So.
Great. Any other questions? Thank you, Lisa.
Thank you.
Old business, none pending. New business, none pending. We have our next tentatively scheduled meeting Monday, December 16th at 10 o'clock.
Before adjournment?
What it says,
10?
we got to hang loose. They move these meetings around.
Holiday.
That's true.
That's what it says here.
It's moved up because of holidays,
Okay.
and it's on Monday. In December, everything's on Monday in December except for E&F, and then we have E&F on Tuesday, and then we do our big open house fee for the employees.
On Tuesday?
And our November meetings are shuffled around too, by the way. I would entertain a motion to adjourn.
So much.
Second. Meeting adjourned.